Adrenergic agonists, also known as sympathomimetics, constitute a very important group of drugs used for cardiovascular conditions, respiratory conditions, and other conditions. Sympathomimetic drugs are agents which in general mimic responses due to stimulation of sympathetic nerves. They are readily divided into subgroups on the basis of their mode of action or spectrum of action. But first let us look at their chemical structures. Adrenergic agonists are classified into two groups based on their chemical structure, catecholamines and noncatecholamines. The thing that differentiate catecholamines and noncatecholamine is the presence of catechol compound structure. Now let's start with catecholamines. Catecholamines are direct-acting adrenergic agonists. If you have heard about adrenergic receptors, direct-acting adrenergic agonists are compounds that directly bind to and activate adrenergic receptors. I do recommend you watch the previous video about adrenergic receptors if you haven't watched it. These compounds can display a high degree of specificity for particular adrenergic receptor subtypes. There are catecholamines hormones that are released by adrenal glands when a person is faced with any type of stress. This is a fight-or-flight response by the adrenal glands that is activated for the survival of the person. The role of catecholamines is to increase heart rate where excessive amounts of catecholamines produce cardiac dysfunction by inducing intracellular calcium ion overload in cardiomyocytes. Increasing breathing rate. Once in the bloodstream, catecholamines like adrenaline binds to receptors on liver cells to break down glycogen into a smaller, more readily usable sugar called glucose. This gives your muscles a boost of energy which binds to receptors on muscle cells in the lungs, causing you to breathe faster. Increasing blood pressure. Catecholamines alter the blood pressure by altering the vascular resistance. Control of the vascular resistance is achieved through vasoconstriction and vasodilation. And lastly, catecholamines increases muscle strength and mental alertness. To support the functions of the fight-or-flight syndrome in the body, blood flow is pulled away from the skin and redirected to the brain, kidneys and heart for this purpose. Some examples of catecholamines in the body are epinephrine, dopamine and norepinephrine. So catecholamines drugs act like catecholamine neurotransmitters. Because of their common basic chemical structure, catecholamines share certain properties. For affinity. They show direct action and they have a high affinity for adrenoceptors. In central nervous system penetration. Catecholamines have poor penetration into the central nervous system since they are polar. Although they stimulate the nervous system, constrict peripheral blood vessels, increase heart rate, and dilate the bronchus. For duration. Catecholamines have short half-life due to their rapid metabolism. Catecholamines are excreted primarily in urine, however, a small amount of isoproterenol is excreted in feces and some epinephrine are excreted in breast milk. Non-catecholamines. Non-catecholamines are direct acting in which they activates receptors directly, indirect acting in which they enhances the release of neurotransmitters from vesicles, and mixed acting which perform both direct and indirect actions. Noncatecholamines are adrenergic drugs that are used to activate the alpha and beta receptors. These drugs do not contain catechol in their nucleus. Some examples of these drugs are ephedrine, phenylephrine, amphetamine, metatramanol and methoxamine. These drugs are used as treatment for various ailments such as against constriction of blood cells, for achieving muscle relaxation with ease, for nasal and eye decongestion and for dilatation of bronchi. In affinity property. They have moderate to a poor affinity for adrenoceptors. In central nervous system penetration. Non-catecholamines can cross the blood-brain barrier and are found in high concentrations in the brain and cerebrospinal fluid. Thus, they can produce a significant effect on central nervous system. And about duration. They have a moderate to longer half-life. Things to note. Catecholamines are only direct acting while non-catecholamines are direct acting, indirect acting, or mixed acting. Catecholamines can't be taken orally because they're destroyed by digestive enzymes. So remember, oral dosing of catecholamines is not possible due to the rapid metabolism of catechol nucleus in gastrointestinal mucosa. In contrast, when these drugs are given sublingually under the tongue, they're rapidly absorbed through the mucous membranes. Any sublingual drug not completely absorbed is rapidly metabolized by swallowed saliva. Absorption by the subcutaneous route is slowed because catecholamines cause the blood vessels around the injection site to constrict. Intramuscular absorption is more rapid because less constriction of local blood vessels occurs. Catecholamines are widely distributed in the body. They're metabolized and inactivated predominantly in the liver but can also be metabolized in the gastrointestinal tract, lungs, kidneys, plasma, and tissues. Don't forget to subscribe and hit the like button to support our channel. Stay tuned for the